Welcome back, everybody, to Medvarsity Deep Dive. Ready for another deep dive?
Always ready to dive in.
All right, well, today we're tackling a pretty intense topic,
Oh, yeah.
cardiogenic shock.
Yeah.
Basically, when your heart just can't keep up with,
Yeah, it can't meet the demands of the body. It's a serious situation for sure.
absolutely life-threatening. And the thing is, it's not like one size fits all. There are different ways it shows up.
Right, different presentations.
Exactly. And knowing the difference, well,
That's vital for treatment, absolutely.
so before we even get to, like, full-blown shock,
Mm-hmm.
are there any sort of early warning signs we should be aware of?
Definitely. Think congestion, things like edema,
Mm.
venous congestion, especially if someone's had a recent heart attack.
Okay, so even before you see, like, the classic shock symptoms,
Yeah, those subtle signs.
they could point to, like,
Yeah.
higher risk.
Exactly. And that's where things get even more interesting because cardiogenic shock, it actually has, it's been classified into three distinct, what we call phenotypes.
Phenotypes, okay.
So the first one, sometimes called the hypoperfusion phenotype, or you might hear it called red line phenotype.
Okay.
And that one's characterized by basically low cardiac output, but without the really high pressures that you might expect.
So it's like the heart's weak, it's not pumping enough.
Yeah, like a tired engine just can't quite generate the power.
Okay, so low output, but pressures aren't necessarily through the roof.
Right. Now contrast that with what we call the congestive phenotype, sometimes green line phenotype. And that's where we see the high pulmonary pressure.
Pulmonary pressure, so like,
Think of it like a traffic jam in the lungs. Blood's backed up. The heart's having a hard time pushing forward effectively.
oh, okay, I get it.
Yeah.
So that brings us to the third phenotype,
The cardiometabolic, or sometimes called the blue line phenotype.
and that one I've heard has a pretty not so good prognosis.
It does, unfortunately. It's the most severe form. You see high lactate levels.
High lactate, so that means
That means the body's cells are basically starved for oxygen. Their metabolic processes are all messed up. You get a buildup of waste products like lactic acid.
so it's like the system's running on fumes, basically.
Yeah, and it's resorting to these desperate measures just to try to keep going, but ultimately causing more damage.
And that all contributes to,
To the over 50% mortality rate, sadly.
wow, yeah,
Yeah.
that really underscores how important timely intervention is.
Absolutely. And that's where hemodynamic monitoring becomes really crucial.
Okay, so what does that involve, hemodynamic monitoring?
So we're talking about things like pulmonary artery catheters, which directly measure pressures within the heart and lungs. We also use echocardiograms, which give us a visual of the heart's structure and how well it's functioning.
So we're not just relying on symptoms, we're actually getting a look inside, like what's happening in the heart itself.
Exactly. So with the pulmonary artery catheter, for example, we can get real-time data on things like cardiac output, pulmonary artery pressure, even the pressure in the left side of the heart. All really important for making treatment decisions. It helps us understand how severe the shock is and how we can tailor the therapies.
So it's not just about recognizing, oh, this is cardiogenic shock. It's about going deeper, like what kind of shock is this?
Exactly. Which phenotype are we dealing with? And then we use these tools to guide our next steps. And ideally, we want to act even before the patient gets to that classic shock stage, what we call stage C in the SHOCK classification.
Okay, now hold on a sec. For those of us who haven't memorized the SHOCK classification, can you give us a little refresher?
Of course. So the SHOCK classification, it's basically like a roadmap of how a patient progresses through shock. So stage A, that's the early stage where we see those subtle signs of congestion that we talked about earlier. Stage B, that's when hypoperfusion starts to become more obvious. And then stage C, that's full-blown shock with clear signs that the organs are starting to fail. So we want to catch it, ideally, in stage A or B, before things get really serious.
So it's like a race against time.
It is.
But it's also about being really strategic, like using those monitoring tools to make the smartest decisions possible.
Absolutely. But it's important to remember these tools, they're not magic bullets. They don't directly treat the condition. They're more like a map.
Ooh, I like that, a map.
Yeah, guiding us through the very complex landscape of cardiogenic shock so we can make the best choices for the patient.
That's a really helpful way to think about it. So as we wrap up here, what's one key takeaway you want our listeners to walk away with?
I think the most important thing to remember is that recognizing the different phenotypes of cardiogenic shock and really understanding how the hemodynamics are playing out in each one.
Yeah.
It's absolutely critical for timely and effective treatment. We can't treat what we don't understand.
Absolutely. And as we move forward, what do you think? What are some of the big questions, the areas where, more research is needed?
Well, I think a key question to ponder is What are the emerging therapies out there? What research avenues are showing promise for improving outcomes in this? This is a tough condition to treat.
It is.
So I think that's something to really think about and keep exploring.
Excellent question. Something for everyone to chew on. And join us next time for another deep dive as we'll tackle another fascinating medical mystery.
I'm looking forward to it.
See you then.
See ya.